Lessons from TB control have informed tobacco control, and combined lessons from the leading killers will be the major drivers to prevent the emergence of the non-communicable diseases.
So due to our political instability from 2005 till 2009, no tobacco control effort has been made in Lebanon. 30 people in Lebanon die each month from second-hand smoke. You have a right to live in 100% smoking-free places, so please ask for your right to have a law to protect you.
The news about the smokers in Russia was quite prominently accepted, which resulted in a tobacco concept where the Prime Minister did call tobacco use a calamity, and since then there have been some good movement in Russia.
In May of last year, they prepared and adopted very comprehensive smoke-free policy with ban smoking in indoor places, transport, uniform, and also no sales and no advertising on the medical facility territory. 54%, or more than half, already provided brief advice to the patients. And what's interesting, 6% doctors and 6% of support staff quit smoking because of the program, after only 3 months.
Smoking and biomass fuel exposure is a pandemic in developing countries and is driving several respiratory diseases. I've shown you that. And COPD in resource poor settings, I've also shown you, is often linked to TB and biomass fuel exposure. And even HIV, there's an accelerated COPD phenotype in HIV. So in many of these patients, you have more than one factor actually operating. And tobacco smoking is a risk factor for TB, and there's a very strong association now, lots of evidence, lots of meta-analyses about this association between TB and smoking, and I feel that smoking cessation programs now require aggressive implementation in high-burden settings.
There are 300 million Chinese who smoke, 28% of adults, 70% exposed to secondhand smoke. It is a challenge given the tobacco control and the tobacco industry structure in China. However, in April, Ministry of Health banned smoking in 29 public venues and in hospitals, encouraging these to become smoke-free.
New media provides a great opportunity for general public to participate in tobacco control activities. The netizens can take photos and publish to their microblog anytime and anywhere. So here is the non-smoking signage over there, and here's a man that he was making phone calls, and he's smoking.
Uruguay is a good example to follow, where a coordinated package of interventions outlined in the Empower has been followed, and what we have seen within a matter of 2 years, there has been a decline of tobacco use, and about 1 in 4 have quit. And the reasons behind this was that Uruguay was one of the first countries in the Americas to go 100% smoke-free. High taxes, comprehensive ad bans or advertising bans, large pictorial warnings, 80% to cover the cigarette packs, banned deceptive terms such as light, mild, and offered cessation services and covered some cost for the nicotine replacement therapies. So it can be done. It can be done as it has been in developed countries, but also it can be done in many other countries.